You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partners Podcast with my co-host, Jeannie Roller. I'm in South Florida. Jeannie, you are in Indiana. The topics today are ones that you sent me like you always do, and this one it's kind of disturbing, but the doctor, it's about a doctor that was in Tennessee, then moved to Kentucky, gets a little bit of convoluted there. He claimed that he had cancer because he was trying to navigate this affair that he was having. I couldn't quite figure out exactly why you would lie that you'd have cancer because you were having an affair, but that's what he did. And then he went on to he did, if I read it correctly, surrender his own medical license, and then what happened with the board and all of that. So you have that story in front of you. It's really sad that doctors at the end of the day are people too, that this kind of thing had to happen. That it's made the news and it had to happen. But like I said, I want to say that some stuff was done to rectify some of it, if I read it correctly. So go ahead, Jeannie. You got more info.
Two patients died that were under his care.
Okay.
Then I think a third one later died.
Okay.
He did surrender his license in Tennessee. And then after learning what was going on in Kentucky, the Virginia Department of Health suspended his medical license.
Right. Yeah.
So he surrendered one and got the other one suspended. And in 2 years, he can go through the process, which is scary, of getting his license back. To me, my opinion, he should not be practicing medicine at all. Which, this brings up a thing that, he wasn't trained to do the interventional cardiac procedures that he was doing.
Okay.
So, that is scary. Now, I know from my investigation of the interventional cardiology, which is this putting in the stents, doing the angiograms, angioplasty, you want a person who's trained. However, where I'm at, some of the hospital systems, for the ones who want to do interventional cardiology, they put them in rotation for emergency procedures. So that's how they get their training, is from the person having the heart attack and they have to have one done right now. They use the inexperienced ones to do those procedures on emergency patients because, you're told that you want someone with experience to do it. So that's how they get their training, unsuspecting people around here. But it was a really whopper of a story he was telling, that he had cancer, and he went to another hospital system supposedly where they asked him to assist in cardiology cases, but then they come to find out, nope, they didn't, and he wasn't certified for any of this stuff. So, my goodness gracious. Cindy, do you have to, before you let a doctor touch you, do you have to look at all of his credentials and verify that they are indeed real ones?
And what is the avenue that's doing that? Apparently, in this case, not too many. That was my first question. So now we got Tennessee, Kentucky, we got Virginia. Thank goodness Virginia kind of looked into it, or seemingly looked into it. I'm like, how did this story unravel that bad? And I have talked to, we're talking about stuff in the United States, but I have talked with people that are in other countries, from other countries. And from what I understand, and I haven't checked it out, a friend of mine is from Germany, born and raised. People are still over in Germany. And she says for their health care, they have strictly on the weekends just PAs and NPs. So don't go to their places on the weekends because you're not going to get a quote-unquote doctor. So all of this kind of stuff. Now, I don't know if that's still valid. This was a couple of years ago that I was talking with her about it. But that's like this guy. Yeah, you're going. It's like being in teaching hospital. And you and I have talked about that umpteen times, that being in a teaching hospital in a lot of ways is great because they're seemingly forefront on a lot of this stuff. They keep up with it, blah, 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 blah. But I've always been told if you're going to having to go do some serious operation with, you could argue basically any of them are serious operations when they give you that general anesthesia. You want to know them the people that know what they're doing, is to go to somebody that's done umpteen, of those type of specific operations to get the best care you can, because they're the ones that can. It's like any profession that you've been in it and your experience with it. If something goes wrong, and that's what you're really paying for, they can zig and zag instantly. Where somebody that's new won't have those kind of parameters. So it's really sad with this guy, but you have to learn somewhere. But they should be under the guide of people right there. I don't know how long that happens, and I'm sure it's every state is different. But the guiding person should be there for a while, under so many hours, I would think. But maybe I'm thinking about a perfect world. I don't know.
Well, 2 points I want to make about teaching hospitals. I was told that nowadays all hospitals consider themselves to be teaching hospitals.
Okay.
And the reason why they do that is they want to attract doctors to come after whatever and work for them. So they all say they're teaching hospitals. Now, the other thing is that you never want to have any sort of volunteer medical procedure done, surgical procedure done in the months of July and August and into September, because guess what? That's when med students are starting out.
Okay.
So you want to, and I've read this in several articles, you wanted to avoid it. But, the thing is, as far as this doctor is concerned, he was working at the hospital in Kentucky, and 2 patients died, which caused them then to review his records. Mm-hmm. So my question is, what kind of process does this hospital or any hospital really use for hiring and verifying a new doctor's credentials? That's the thing.
From the get-go, yeah. Right.
Yeah. And that's the thing with any of these people that they hire, just not doctors. Because, I've read several stories about people faking RN credentials.
Right. Yeah.
So, what procedures do these hospitals go through to hire these people? They got to, it's their responsibility to safeguard patients, make sure that the people that they hire are indeed the people that they think they're hiring.
Right.
And it's not my responsibility as a patient to say, hey, let me see this and this and this, and I'll get back to you after I verify it.
Right.
I can't do all that.
No. We don't have we don't have the capacity to do that either. I don't mean mental capacity. I mean just, across the board. We're not privy to licensing and all that kind of stuff. That's what you're paying for. Right. That's what, here we go again. That's what your trust is for. When you go to a mechanic with your, say, BMW or your Ford or, whatever, Toyota or whatever, those different mechanics, and I'm certainly not trying to align medicine with mechanics. I'm just using it as an example. They're trained on that BMW. They're trained on that Ford. It's, unless you go like to a general mechanic, if you're going to the dealership, that's what it's about. Yeah. Some of the stuff is the same, change in oil, those kind of things, but there are specifics to that, and that's what you're paying that surgeon for. That surgeon should be highly vetted, or that doctor, that specialist should be highly vetted without you worrying about it. You're not, you're just worried about your insurance and getting better. And, how much is this going to cost? And who wants to worry about that? We're going to do a show about that too. But you're worried about getting well and getting the best care you can get. You're not worried about calling up, the RN board or the, the whatever, the cardiac surgery board or whoever. I wouldn't even know where to start with some of that stuff, but it's almost like we have to walk around with an encyclopedia for all of this stuff. And if they even exist any longer, encyclopedias, I'm probably dating myself by saying that. But of all this stuff, who's minding the store? Who's minding the store? And we've said this so many times. When you get into and we label them the big box healthcare ones, when you get into these big box ones, it's like, column A, column B, fill this out, that's it, you're in kind of thing, is because we keep bringing these stories up. Yeah. And it's random. It's all over the place. It's not just, so now let's go to, whatever hospital, whatever center in so-and-so, and let's get that fixed. It's all over the board. It's all over the place. So what do we as the patients do before we have some serious or really any kind of health care? I ask 1 or 2 doctors that I trust their opinion. That's my solution. And then I will ask for people's recommendations. But they haven't always panned out. My friends' recommendations, they haven't. So on that note, you have to do your best homework that you possibly can and, really hope for the best. Stay listening to Evergreen Media Network.